Hello, Nursing 541. This is Tom. I am going to talk to you today about the Doctor of Nursing Practice, or DNP, the hot new degree in nursing. It's been said that brevity is the essence of wit, so I will attempt to be as witty as possible during this talk, and we'll get right into it. So the Doctor of Nursing Practice is the hot new degree in nursing. American Association of Colleges of Nursing data has definitely shown that's to be true for the last decade. For instance, to compare, PhD programs from 2004 to 2013, their enrollment went from 3,439 students to 5,124 students. That's a 49% increase. Not insubstantial. However, from 2002 to 2013, DNP enrollment went from 70 students to 14,699 students. That's a 20,898% increase. So what is it that the Doctor of Nursing Practice does? What is the DNP primarily concerned with? The Doctor of Nursing Practice is concerned with nursing knowledge, but not the creation of original knowledge. They're concerned with the synthesis and the application of that knowledge to clinical and to other nursing practice. Many people are aware of the Doctor of Nursing Practice and its relationship to the nurse practitioner. The plan was to have the DNP be the requirement for nurse practitioner licensure, and that hasn't quite happened yet. It is now simply recommended, but things are on path to have the DNP be the requirement for advanced practice nursing in the United States. Although the DNP has actually been around longer, in 2004, the AACN issued a report where they spoke on the future of nursing and promoted the DNP as the choice for doctoral education for nursing practice. And that began the whole process of the DNP moving forward. So why is the DNP enjoying such a meteoric success in the last decade? Essentially, there are three issues that we could speak of. The first is that the DNP is an expert clinician. Patient care is becoming increasingly complex, and there is a major emphasis on multidisciplinary team patient care. That's extremely important in the history of the DNP, in that other members of this multidisciplinary team have their doctorates. So it's important that nurses providing this level of care also have their doctorate. There's a massive need for nurses, and with that comes the massive need for nurse educators. As a clinical and practice expert, the DNP is the perfect choice for providing nursing education. As healthcare becomes increasingly complex with reimbursement issues and Obamacare and legislative issues and all that going on, doctorally prepared nursing leadership is desperately needed. So more about why the DNP. In 2010, the Institute of Medicine issued a report about the future of nursing, where they suggested that we increase the number of BSNs by 80% by 2020 and double the number of doctorally prepared nurses by 2020. They suggested this happen by increasing funding to nursing programs. Sounds like a good idea. And utilizing the BSN as a doorway to advanced degrees. They suggested that 10% of BSN graduates should move on for a master's or a doctoral degree. So this begins to explain the idea of the importance of the BSN to the future of nursing. They also recommended that we have transition programs at all levels to allow people with degrees from other disciplines to enter into the nursing field and move through as rapidly as possible. So how pervasive is the problem of increased demand for nurses and nurse educators? According to the AACN, in 2011, the number of students turned away from nursing schools, BSN and MSN programs, for lack of faculty, surprisingly 75,000. That's 75,000 students who were unable to be educated to help meet the demand for nurses because they didn't have enough faculty. In 2012, it was 80,000. 80,000 students turned away from nursing programs for lack of faculty. So I wanted to talk about, give some history on the DNP and other nursing doctorates, but some frame of reference for the DNP. The first is the Doctor of Nursing Science. I have here listed ND, DNS, DSN, DNSC, because there's a lot of confusion about what these things were called and what they were. I recall graduating from my first degree in Widener, and at that graduation there was the first group of Doctor of Nursing Science students graduated. I think there was 3 or 4 of them, and while we sat and listened to the different talks and speeches, and they came up to receive their degrees, their doctoral degrees, someone behind me exclaimed out loud, "Are they doctors or are they nurses?" And people laughed, and it was kind of amusing, but he actually did have a real point, because there was a lot of confusion, not just among the general public, but among nursing also. The degree itself was very rigorous, science, theory, and research focused, but unfortunately it became undistinguishable from the PhD. And there was a lot of confusion about what it really was. And although it was essentially equivalent to a PhD, it didn't get the respect that it needed and that it deserved. So it began to fade away. Many schools have removed the Doctor of Nursing Science degree. Widener's one of them. They now offer the DNP and or the PhD. Some colleges have converted previously awarded Doctor of Nursing Science degrees to PhDs. And if you read the current literature, you don't really see any mention at all of the DNSC. You'll see the DNP and the PhD, so it seems like it's beginning to fade away. So the other doctoral degree comparing to the DNP is the PhD. And this is a traditional terminal degree in nursing. It's recognized worldwide. The PhD is concerned with the creation of original knowledge through original research. And it's the DNP and the PhD collaborating on the creation of knowledge and the synthesis and application of that knowledge to practice. That is the key to the future of the DNP in nursing. So as I said earlier, the DNP is responsible for the synthesis and application to practice of knowledge, but it's the PhD that creates the original research, that creates the original nursing knowledge. So it's the two of them coming together. It's the original research from the PhD, the synthesis and application by the DNP, and together that equals improved clinical outcomes. As I mentioned earlier, there is a big need for nurse educators. Nursing has to meet this demand. Graves et al. In 2013 wrote that the nursing faculty shortage is directly related to the ongoing shortage of nurses. The DNP is an expert clinically and in the field of nursing, and they're an excellent choice for educators. We have the DNP teaching, we have the PhD also teaching traditionally. There also is the Doctor of Education, and there is some movement to have that as a third requirement or a third avenue for nursing education. And the question remains, do we actually need all three? Does the DNP, the PhD enough? Do we need a third specific degree to teach nursing? We also have to consider whether we are taking the experienced clinicians away from the role, their clinical roles, in order to increase the number of faculty. And we also have to wonder why there is no DNP nurse educator track. If the need for education is so clearly seen, why is there no way for there to be a specific DNP nurse educator? So what is the fit between the DNP and nurse executives? Swanson and Stanton in 2013 published a study where they indicate that chief nursing officers believe the DNP is an appropriate degree for their role. They point out that the qualities that the DNP possesses, leadership, health policy, system improvement, research and evidence-based practice, teamwork and collaboration, are all qualities that match those required by chief nursing officers. Interestingly, they also pointed out that the CNOs who are currently in positions, while they support the DNP, had no intention of returning for the DNP themselves. So that raises the question of the future, whether the DNP will become the necessary degree to become a chief nursing officer. So how does one address the DNP in the clinical setting? In the educational setting, we're very comfortable referring to the DNP as doctor. What about in the multidisciplinary team where other people have their doctorates also? What about the multidisciplinary team where members are physicians? How do we handle that? As the DNP is becoming more ingrained into the multidisciplinary team, there has been some pushback. The American Medical Association has launched a Truth in Advertising campaign in which they seek to limit the use of the title doctor to only those persons who are licensed physicians. They've been successful in several states in having legislation passed which restricts or limits the use of the title doctor to only physicians. In 2010, Chisholm wrote that while the title medical doctor is protected by statute, no one discipline owns the term doctor. In a multidisciplinary team, there are physical therapists with doctorates, there are pharmacists with doctorates, there are audiologists, there are psychologists, and they're all doctoral prepared practitioners operating as part of the multidisciplinary team. Being able to freely use the title doctor is an issue of parity. And parity is the idea that how level is the playing field? Considering our professionalism, education, collegiality, our pay, autonomy, free use of the title, how do those things compare to other health professions? Chisholm in 2010 wrote that in some cases, the number of credits required for an MSN exceed the number of credits required for a doctoral degree in other health professions. Can we consider ourselves on equal ground when we need to have an excessive number of college credits just to be considered equal? Physical therapists, pharmacists, audiologists, psychologists, they all have doctoral level programs. And how do we fit as part of the multidisciplinary team? How do we fit with those people? And what happens when the CRNA begins to require a doctorate also? How will we know when we have true parity? I believe that it will become apparent that we are on equal footing with other health professionals with doctoral degrees when it pays. When money talks and we are receiving equal compensation on par with other professionals with doctoral degrees, that's when we will have true parity as nursing professionals. So thanks for listening. It was great. Here are 2 questions that you can use for discussion for this week for the online portion. Discuss the issue of title. Are DNPs entitled to be called doctor in clinical settings? And number 2, discuss where the DNP fits in the future of nursing. Is it worthwhile? Would you consider it as a career choice? Thanks all. Bye.